Greetings. Today we'd like to welcome a guest to our program. This is Daria Bannerman. Daria is a person who has experienced retinopathy of prematurity and has gone on to have a full life and is a part of our Aspect program. You may have heard us mention the Aspect program before for Prevent Blindness. So we're going to talk to her a little bit about her experiences. Welcome to the program, Daria.
Thank you, Chris. Thank you for inviting me to be here.
My pleasure. To start, please tell us a little bit about your journey. I know that ROP is something, obviously that people deal with from their infancy on. What kind of impacts did it have on your life?
So I'm Daria Bannerman. I was born in 1989, May the 27th. I was born weighing 1 pound and 7 ounces. The doctors didn't expect me to make it, but God saw fit that I lived to tell this tale. I do have retinopathy of prematurity, and that is caused by being born at such a low weight. I think I was even born at below 31 weeks. So that's how I developed it. Had to be in an incubator. They gave me too much oxygen, and that's how my visual impairment and blindness got started with that. Just because I had to have that oxygen to breathe on my own and things like that with ROP.
Okay. And so, because of this condition, I'm guessing that you basically grew up dealing with blindness. Is that correct?
Yes, I did grow up with this condition all my life and was blind since birth. So I had to learn a lot of things to help me as a blind person. So I had to learn Braille at age 6. I had to learn to use a cane. I had to learn like mobility skills that helped me as a blind person. So getting extensive training at a school for the blind in North Carolina that I ended up attending at age 7, which helped me out a lot
Yeah.
because then I met people who were blind like me. They didn't have my condition, but they could identify with what I had to adapt to because they had to adapt to some similar things as well.
Mm-hmm. All right. Now, you mentioned, of course, learning Braille, going to special schools. Were there other things that contributed to your ability to just function in society? Things that were helpful to you that you would like to sort of highlight? People who are maybe newly blind and looking for help or support or systems, places that they could turn.
Um, yeah, that's a good question. So I would say to people that are like newly blind or visually impaired, it's good to get with like a state rehabilitation service, like a services for the blind. I know in North Carolina they have a division of services for the blind, so that's like a good start because they can recommend programs, help you get a job, help you if you want to go to school. They probably have information on support groups. I would say like Hadley is a good one because they have classes that can teach you independent living skills. They even have self-defense training if you ever need it. I know the NFB and ACB and even AFB, those organizations could be of great support because they have people with visual impairments and blindness that have experienced what people who are newly blind will experience, and they can kind of be that sounding board. Also, the Aspect program, I have to advocate for the Aspect program. I've got to put them on blast in a good way because every time I've gone to the meetings throughout the program, it was like joining one big old family. It was like one big party every time.
Hmm.
Um, and it was a great place. Like if people were getting vulnerable and were getting emotional, everybody just conveyed support right away.
Okay. And thanks for bringing that up because I know you are a member of the Aspect program. I am an alumni of the Aspect program myself a couple of years back. And for our listeners who are not familiar with Aspect, in your own words, uh, try to tell them a little bit about what the Aspect program is.
So the Aspect program is a part of Prevent Blindness, and it's a program that helps you learn to be able to speak up for yourself, to advocate for yourself through telling stories. So we do this by having like 5-minute stories that we tell in front of the group every time we meet. We get feedback on um, how well the story was and what improvements would be needed to the story. We also did improv in case you get in front of legislators and need to advocate for things that can relate to prevention of blindness for even children who may not have those services and need them. So you get a lot of training on advocating for yourself, being a storyteller, and then using that to advocate for bigger issues when you get
Hmm.
in front of Congress. And it's really encouraging. The Aspect program is, I think the facilitators of it do a good job of encouraging people, of lessening the tension, because it isn't always easy to talk in front of people. But if you have a supportive group like them, they definitely will get you together in the storytelling arena.
I definitely agree with you there, Daria. And in fact, for listeners who would like more information on the Aspect program, you can go to our website, preventblindness.org, and take a look there. There's a great deal of information about it and how to join in future cohorts of the Aspect program. So, Daria, may I ask, are there particular topics that you are interested in advocating on?
I am interested in just advocating for, I guess, anything that's related to prevention of blindness if you can detect it early. Because I have ROP, and it is something that parents have to make sure they get their children checked often to see if conditions are worsening so that they could try to treat it if possible, just to make sure things are where they need to be with the condition, because I know it has a lot to do with um, abnormal blood vessels growing on the retina, which sends you light to the brain so that you can see. And it has stages. So there's 5 stages to ROP. So the earlier the stage, like in stages 1 and 2, they can treat it if they're at those stages. I think the higher the stage, the more severe it is, which is why it's important to, if you can, get your child who may have ROP to an ophthalmologist to get checked often so that things can be prevented if possible and if resources are needed if it can't be prevented.
Okay. All right. So I think that's very good. I think it's fair to say then you'd recommend that if parents are dealing with a situation, especially if they have a child who's premature or has other health related issues that may not be directly connected, that they should try to get their child screened if at all possible.
Yes.
Um, and I would also like to ask, based on your experiences as a person who has lived their life with blindness and a person who has a full and active life, um, Can you say a few words to people who may be sort of wondering, what can I do? What am I capable of?
So I'm of the mindset that with the right supports, you can do whatever you're needing and wanting to do in life. So I was blessed to have a family that supported me and advocated for my needs when I needed to go to a school for the blind to get resources because the public school systems didn't have those. I was fortunate to have friends that had blindness and visual impairments. And so I was able to have people that could be like a listening ears for me and have those people be able to relate to me, and just having people pushing me to be my best self, um, whenever I needed them. So it's like when they supported me, I knew that I could do certain things like graduate from high school and go to college and get 2 degrees and then get into the workforce, um, doing various jobs. Like now I work as a customer service rep full time, and then I'm a part time clinical social worker where I help people get some therapy for services that they need, do clinical assessments, and recently started working with youth that are dealing with substance use. So I would just say if it wasn't for the support system and my belief in God, it would have been a lot more challenging to do those things. But I believe that whatever you're wanting to do, as long as you have that belief in yourself and you have a good support system behind you, you can do the things that you're wanting to do. There are going to be some challenges. Sometimes I second guess myself if I could do these things, if I fit into these spaces. But with my own advocacy work through speaking to college students about people with disabilities navigating college and being able to do things we do with the assistive tech that we use and things like that, it's like one step closer for everyone knowing that we do have a space and we do belong, and whatever we want to achieve in life, we can do that.
Perfect. So yeah, I think for our listeners, the message is to be positive, and for those who are allies to be supportive. Aria, is there anything else that you would like to share with us? Any message you'd like to give to the listeners in general or to the blind and low vision community based on your experiences?
I would say the biggest takeaway is just to have a good support system. Never give up on what you're wanting to do. There's always a way that is possible, even if we don't know it, which is why I stress so much about having a good support system. Turn into these state agencies, turn into support groups, like the Aspect program, so that you can get in touch with people who relate to you, who maybe they have solutions that you don't have yet. You don't have to do this alone. There are other people that are going through maybe struggles at times. How am I going to be able to go to school? How will I talk to professors about the accommodations I need, and to employers about what my skills are and how I can do the job? But if you talk to other people and you reach out to them, that can be possible, even if sometimes it is scary. Being fearful is nothing to be ashamed of.
Yeah. All right, that's fantastic, Daria. I would like to thank you very much for coming on the podcast, and I believe your story will probably be really valuable to our listeners.
Thank you so much for letting me tell my story. It was really fun to do.